Hello, everybody. I'm Wendy Singer, Director of Programming for No Shame on You. Today, we are with Naomi Scholder, one of our amazing interns, and this is our next video that is part of our No Shame on You Mental Health Club video resource library that teens across the nation can use for their mental health clubs. Today's presentation is the impact of health inequities on mental health. Naomi, take it away.
All right. Thank you so much, Wendy, for that introduction. And thank you everyone for being here today to listen to this presentation and educating yourselves about this issue. So today I will be presenting on the impact of health inequities on mental health. Imagine your car breaks down on the highway. What do? Dr. Ballender explains stigma and health inequities against people of color with the following metaphor. If you do not know how to fix your car, you don't usually just abandon it on the road and never go back to it. You find a mechanic to fix it. So, in the same way with mental illness, it's a set of tools and it's a skill set and it's training. So, if you don't know how to do that yourself, then you go to someone who does help and who has those abilities to help you heal yourself. Ironically, there are around 630,000 mechanics in the United States and 4,500 psychiatrists. There are 276 million vehicles registered in the United States and 329.5 million people. These statistics are scary. Why is it easier for you to get your car fixed than it is for you to get help with your mental health? Through this presentation, I hope to explain what prevents specific groups of people from being able to get help and what can be done to change that. Hopefully, one day, our world will have 630,000 psychiatrists to help serve a population of 329.5 million people. Before I start, I wanted to define some key terms that I will be using throughout my presentation, starting with health inequity. Health inequity is differences in health status or distribution of health resources between different groups, which is a result of the conditions which people are born into or live in. Structural inequities. Structural inequities is how your identity plays a role in whether or not you're able to attain care. Stigma. Stigma is a negative attitude or discrimination against someone based on a distinguishing characteristic. Structural stigma. Structural stigma are laws and policies that impact the treatment of people with certain experiences. Bias. Bias is a strong inclination or preferred opinion about someone or something. Systemic bias. Systemic bias are procedures and practices of institutions to operate in a way that results in certain groups being advantaged or disadvantaged. Parity. Parity is that if your healthcare plan offers unlimited doctor visits for chronic conditions, it must also offer unlimited visits for a mental health condition. When we get into the insurance section of the presentation, I will explain different types of healthcare, which include Medicaid, Medicare, and the Affordable Care Act, also known as Obamacare. Don't worry too much about these definitions, as insurance is an extremely complex topic. And even after taking a course about it, I still struggle to understand all of it. Another important thing is to know the difference between inequity and inequality. These two definitions deserve their own page as they are often confused with one another. Inequity. Inequity is the unequal distribution of power and resources. It is a result of unfairness and injustice. Inequities are avoidable. Inequalities are unbalanced conditions. For example, rural areas aren't destined to have poor healthcare. Rather, it happens because of things like budget cuts, fewer physicians, and having to travel farther to get care. Inequality. Inequality is an unfair situation in society where some people have more opportunities than others. This picture explains the difference between reality, equality, and equity. In the middle photo, we see that every person has one box. However, not everyone needs a box to be able to see over the fence. And even with one box, not everyone is able to see. So our friend in the blue shirt is able to see way over the fence when our friend in the purple shirt is not even able to see it with the box. Equality means that everyone gets the same. Equity, however, means that everyone gets what they need in order to be successful. So, as we see now, our friend in the blue shirt has nothing, but he's still able to see over the fence, and our friend in the purple shirt has 2 boxes, which helps him see over the fence. Mental health is common. The CDC reports that mental illnesses are among the most common health conditions in the US. 1 in 5 people will experience a mental illness in their lifetime. If there are 25 people in one of your classes, around 5 of them will experience a mental illness. However, almost everyone knows someone personally who lives with a mental illness or themselves live with one. More than 50% of the US population will be diagnosed with a mental illness at some point in their life. 50%. What is health inequity? Health inequity is an issue that impacts every place in the world. To understand the impact of health inequities, it is important to note that health inequities make up only one part of the equation. Relationships with others, institutions, which include your job or employer, and systems in place, which include laws and policies, are all part of the equation that sort people into resource-rich or resource-poor neighborhoods. This sorting affects things from schools, housing, access to food and doctors, and much more. The quality of neighborhoods and schools shape the life path and health of adults and children. The impact of health inequities follow individuals for their entire lives from womb to tomb. Discrimination, racism, xenophobia, and more are generally associated with worse mental and physical health of individuals. People of color experience higher rates of poor health and disease compared to white people. The CDC reports that the average life expectancy among Black or African American people in the US is 4 years less than that of white people. People of color are disadvantaged compared to other groups over time. They are often overrepresented in populations living in poverty compared to the overall US population. Though poverty rates have decreased, people of color are still twice as likely to experience poverty. Living in poverty leads to increased dangers in health, exposure to disease, and unequal access to adequate education, among others. Health and poverty go hand in hand. Poverty is both a cause and a consequence of poor health, and the two work together to trap people living in these communities. How do health inequities impact mental health? People living in poverty, which in the last section we learned tends to be people of color, have the poorest reported overall health and mental health. This is because these neighborhoods have less resources, and people living in them are more likely to experience unemployment, homelessness, and substance abuse and crime. Poverty is related to poor mental health for 2 reasons. People living in poverty are more likely to be exposed to stressful environments and less likely to have a cushion of social and material resources to fall back on. Having a mental disorder can take a toll on the individual's functioning and productivity that does not always, but sometimes lead to poverty. Bias also plays a role in limiting access to mental health care. Mistrust of mental health services and professionals is an important reason that stops minorities from seeking treatment. Their concerns are backed by evidence of clinician bias and stereotyping. Medical mistrust roots back to the mistreatment of African Americans during slavery, where they were medically experimented on without consent. Ruth White, a professor at USC, explains, as a country, we need to make meaningful policy changes that will increase mental health care for people of color so fewer African Americans will go without the treatment that they need. The mental health systems and services in place fail to provide adequate and culturally appropriate care for people of color in America. For example, African Americans are more likely to be incorrectly diagnosed than white Americans. People of color are also more likely to experience discrimination in healthcare, be misdiagnosed, refused treatment, and have difficulties obtaining care and insurance. White explains, if an African American person with a mental illness acts out in violence, they're much more likely to be criminalized than given the opportunity to receive mental health care. Stigma. Stigma prevents people from getting care and/or treatment for their mental illnesses. Stigma is especially an issue in diverse and ethnic communities and can act as a barrier for them when accessing mental health services. Because of stigma, people living with mental health conditions struggle feeling comfortable discussing their feelings with friends and family. Stigma can lead to worse symptoms, feelings of isolation, and reduces the likelihood of people seeking out and receiving treatment. There are three main types of stigma: public, self, and institutionalized. Each affects the individual differently. Public stigma: negative or discriminatory attitudes that others have about mental health. An example of public stigma is that people with mental illnesses are dangerous and should not be trusted, when in actuality, the majority of people with mental illness are victims of dangerous acts and not the perpetrators. 2. Self-stigma. Self-stigma is negative attitudes, including internalized shame that people with mental illness have about themselves and their condition. An example of self-stigma is feeling that you are a burden to others. 3. Institutionalized stigma. Institutionalized stigma is when organizations intentionally or unintentionally limit opportunities for people with mental illness. An example of institutionalized stigma is not hiring someone because they have a mental illness or having fewer mental health services in comparison to other healthcare services. Racial and ethnic minorities face issues in getting care more than their white counterparts, but they also have to deal with the stigma surrounding mental illness in their culture and community. This is not to say that stigma surrounding mental illness is not a universal experience and that everyone can experience stigma. However, on top of the other barriers racial and ethnic minorities experience, stigma is only another roadblock in preventing them from receiving the care they need. Insurance coverage. Insurance itself is an extremely complex topic. I do not expect you to understand everything surrounding different policies, in-network versus out-of-network, deductibles, premiums, so on and so forth. However, it is important to understand the role and for others the barrier that insurance plays in getting care and treatment. Going back to the car example, not having insurance is just like not having driver's insurance. So if something were to happen to your car and you don't have driver's insurance, you have to pay for any of these services out of pocket. The same as for mental health care. If you don't have insurance, the treatments, medications, therapy that you're attending, you have to pay for it with your own money instead of insurance helping you pay for it. Being uninsured causes include rising healthcare costs, public program cutbacks, and employers not providing insurance to staff. Being uninsured means that you have to pay for your services, which include hospital services, medications, and treatments with your own money. People of color are at a higher risk of being uninsured compared to white people. Over half of adults with mental illness do not receive treatment, totaling over 27 million adults that go untreated in the United States alone. There are three main ways for people who do not have insurance to become insured: the Affordable Care Act or Obamacare, Medicare, and Medicaid. The goal of the Affordable Care Act is to decrease the amount of uninsured people in the United States by extending healthcare coverage to around 32 million Americans. It hopes to improve healthcare access, quality, and individual and public costs. The ACA, or Obamacare, was signed into law in 2010 and has dramatically reduced the uninsured rate of people in America. As of recent, over 20 million people have gained insurance coverage since the law was implemented. The expansion of the ACA has also helped reduce racial disparities in health coverage and the access of care for people of color. Though these issues still continue to affect racial and ethnic minorities, the ACA has dramatically increased access. States such as Arkansas and Kentucky that have expanded ACA coverage saw that adults were more likely to have a personal physician, receive care for chronic conditions, and receive annual checkups. Medicare. Medicare is the federal government program that provides health care coverage for people over the age of 65. It is 4 parts, A through D, all of which provide different services. Different kinds of mental health services fall under different parts of Medicare. For instance, Part B covers 1 depression screening per year, psychotherapy, and medication management, whereas Part A covers mental health inpatient care. You immediately qualify for Part A and Part B when you reach the age of 65. Part C is not a separate benefit, but rather the Advantage plan of Medicare that uses private health insurance to cover the services that you receive from Part A and Part B. Part D is provided only through private insurance companies with government contracts. Medicaid is the public insurance program that provides health coverage to low-income families and individuals. Eligibility is based on income. Medicaid benefits include inpatient and outpatient services, physician services, laboratory and X-ray services, among others. Medicaid coverage for mental health needs is more vast than that of some private insurance. However, this is not to say that it's not easier for those with private insurance to retain care, which it often is. Many people with mental illness become eligible for Medicaid by qualifying as disabled, either as children or as an adult after they turn 19. Though the ACA, Medicaid, and Medicare have dramatically increased access, it is also important to know how you can go about getting care and access to medication. If you are uninsured, speak with your doctor if you have trouble affording medication. They should be able to provide you with free samples for a time period or switch you to a less expensive brand name or generic form of your medication. Many states provide government prescription assistance programs that help pay for prescriptions and treatment. There are also tons of nonprofit prescription assistance programs. Moreover, the ACA or Obamacare requires that your health plan covers mental health equally to other treatments, which is the idea of parity discussed earlier in the key terms section. Mental health parity laws require the coverage of services for mental and behavioral health and substance use disorders to be comparable to physical health coverage. Access in rural areas. 1/5 of the US population lives in a rural area, and about 1/5 of those living in rural areas have a mental illness. 113 million people currently live in areas with a shortage of mental health providers. In order for a state to be considered as having a shortage of providers, the area must have a population to provider ratio of a certain threshold. The population to provider ratio for mental health care must be 30,000 to 1. When addressing rural disparities, it is easiest to understand how they impact the population by categorizing the barriers into 4 groups, which I have named the 4 A's. Accessibility. Workforce shortages in mental health care are greatest in rural and low-income areas. Not all individuals have a car to go get care. Because there are so few providers in rural areas, people have to travel farther for mental health services. If you cannot get access to transportation, care might be inaccessible altogether. It's estimated that as many as 65% of non-metropolitan counties do not have psychiatrists, and over 60% of rural Americans live in designated mental health provider shortage areas. Availability. Rural areas often face a lack of availability of mental health care for 2 reasons: a shortage of behavioral health care clinicians and a higher proportion of people with a serious mental illness that use public funding. Another issue in terms of availability is a lack of specialty mental health care in rural areas. Messaging and programmatic strategies specifically made for populations that are helping that address the differences in mental health prevention in different groups of people are extremely beneficial when providing care to people in rural areas. For example, 29% of all American Indians live in rural areas compared to 15% of the total US population. When addressing the mental health of these populations, we must take into account their experiences and cater the care to them. Affordability. Insurance is a barrier for people in rural areas. Some services are not covered by people's providers, making them too expensive for a patient to pay for. A little over 5 million rural residents live in counties that have high and persistent poverty rates. This poverty serves as a barrier, limiting people from accessing medical and mental health services. Acceptability. Lack of anonymity and privacy is a unique challenge in rural communities when attaining care because of the size of the community and the few choices of trained professionals. These two factors, among others, can lead to a lack of faith in confidentiality. People in rural communities are hesitant to receive care because of stigma surrounding mental health in their communities. Access in schools. Schools play a major role in providing access to care for their students who otherwise may not be able to access it. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year, and of these, only half of them receive any kind of treatment. Undiagnosed and/or untreated mental illnesses can interfere with a student's ability to learn, grow, and develop, which is why access to mental health care in schools is essential. NAMI found that youth are equally as likely to receive mental health services in an education setting as they are from a specialty mental health provider. By removing barriers such as transportation, scheduling conflicts, and stigma, school-based mental health services can help students access needed services during the school day. 23 states currently require school counselors for schools with students in grades K through 12. Many of these states that require school counselors have some of the highest rural populations in the country. Schools are a natural setting for mental health care. As they're a place where children spend a majority of their time in. Because of this, schools play a critical role in supporting students and providing a safe and supportive natural environment. The ways in which schools implement mental health services vary, from school-based therapists, social workers, prevention programming, and early identification of mental health challenges and providing treatment options. However, not all schools receive the same funding, and this causes inequity within school systems. For example, in Hartford, Connecticut, higher income towns have easy access to guidance counselors and school psychologists, but in high poverty areas, this access is close to none. Public school districts in almost all of America are funded by local property taxes. So in high poverty areas, homes have lower value and collect less taxes, resulting in this differential access within schools. We think the state's responsibility is to ensure that every child in every school district, regardless of whether they're impoverished, is given the opportunity to graduate from high school, said Jim Finley, the principal consultant for the Connecticut Coalition for Justice in Education funding. The American school system is inadequately funded and inequitably distributed. Schools in high poverty areas simply do not have the funding to have counselors and to provide their students with mental health care. So while schools are extremely beneficial in providing aid to their students, work needs to be done to improve care. Thank you guys so much for listening to this presentation. If you guys would like to learn more about the subject or want more information on specific areas that I talked about, please visit these links. And we also have some discussion questions for you to talk about with your peers. So the first one is, what are different ways to reduce health inequities? What can teachers and other adults at school do to better support their students and their mental health? Is it the government's job to provide mental health care for all of their citizens? What are ways to reduce stigma surrounding mental health? How do we start having these important conversations about mental health? Again, thank you guys so much for taking time out of your day to learn about this important issue, and I hope you guys take away some valuable information. Thank you.